This briefing gives more information about one of the challenges that will be the focus of discussions at the consultation workshop. A. What an Education, Health and Care Plan, EHCP, should achieve. This briefing will cover what is an EHCP, how should it work, good EHCPs in practice, the challenges in Tower Hamlets. Background. Most children with special educational needs, SEN, do not need an EHCP. A school or college supports most pupils with SEN using the graduated approach. However, if needs are high level and the pupil's learning a long way behind after several terms using the graduated approach, the school and the parents might think of applying for an EHC needs assessment. It is also useful for parents to know about a school's SEN information report. All schools must produce a report that describes how they support pupils with SEND. They must post this on their website and update it every year. What is an EHCP? An EHCP is a legal document. The plan describes a child's education, health and social care needs and the support needed to meet these. It also sets out what the child wants to achieve and the outcomes that will help them to achieve these things. An EHCP can last up to the age of 25 if there continue to be education and training needs. If education or training outcomes have all been met, an EHCP can be ceased, usually following an annual review. This does not mean support is ended, but it marks good progress and the support should adapt and change. How should an EHCP work? Important elements of a good working with an EHCP include annual review. All children with an EHCP must have a review of their plan once a year. An annual review is organised by the school or college. It should take place before the anniversary of the EHCP being issued. All should be told about the date and the time far in advance, in particular parents, also professionals who are asked to attend. If they are unable to attend, they should provide a written update. Following the annual review, the council should be told if any changes are proposed within 2 weeks of the annual review. Other planning at school. Schools have more detailed plans about the learning and support of all pupils within EHCP. EHCP outcomes are broad. They cover health, care and education needs and should be lasting for about 2 to 3 years, whereas other school planning will follow a pupil's progress in class and what is going well on a weekly, half-termly and termly basis. Transitions. Changes are often even harder for children with SEND. Good planning is very important for big changes such as starting a new school, and EHCP outcomes should cover this, and an annual review should make sure that preparations are in place. Another requirement for the biggest change of all, which is getting ready for being an adult, is that from age 14 all EHCPs must have at least one outcome which is about preparations for adulthood. Good EHCPs in practice. In a school or college, quality first teaching should be available to all pupils, including those with an EHCP. This is high quality teaching where lessons are carefully planned. This planning is based on current learning, what has been learnt before, what should be learnt next. It includes planning to meet support needs and expects high achievement of all children. Using support staff well. Teaching assistants are very important for many pupils with an EHCP. Where there are teaching assistants, they should be part of a team in the class and they should know how best to help a pupil with an EHCP learn. Sometimes this can be by not being right alongside them. In fact, extensive research has shown that for a pupil with SEND, a lot of one-to-one time with an assistant can actually get in the way of them learning. Updating outcomes. EHCPs are quite new, and schools and the council are still working on how best to word outcomes, how to use the outcomes. However, outcomes should be looked at during annual reviews, and they should be changed or updated every 2 to 3 years. Person-centred. Schools should work closely with the family of children with SEND. This should include planning annual reviews so that the views of the child and their parents are heard. This is very important to encourage independence and to make sure that planning fits with the achievements and the ambitions of the child or young person. The challenges in Tower Hamlets. The quality of EHCPs. We know that written outcomes and what is in EHCPs about support for health and support for care needs are not yet as good as they should be. Active monitoring of annual reviews. The council should remind schools or colleges when annual reviews are due and should be told about any proposed changes within 2 weeks of the review taking place. We are still in the process of setting up this system. Celebrate achievements. We want all children with SEND to achieve. How could we do more across Tower Hamlets so that the achievements of children and young people with an EHCP can be celebrated? EHCPs and top-up amounts rarely change. The purpose of an EHCP should be to encourage learning and development. How can we give more attention to keeping EHCPs up to date and the top-up amount changing to reflect the support that each child needs? We are very interested in your views about these. What else should we be thinking about?